In this video, I'm going to teach you what a Kegel is and how to perform it correctly. A lot of women believe that they're doing a Kegel correctly, but when we actually assess them, as a pelvic floor PT, when I assess, a lot of times I will see that a woman is either bearing down super hard or she is actually not squeezing at all or whatever it is. So I'm going to teach you what a Kegel is and how to perform it correctly. So number one, a Kegel is a pelvic floor muscle contraction. So what is that essentially? So your pelvis, here's your pelvis right here. Your pelvic floor muscles consist of the muscles that form a sling, like a hammock basically, from your pubic bone all the way down and across to your tailbone. So your tailbone being right in through here, the very tip of your sacrum, which would be that triangular bone right at the base of your spine, okay? So the pelvic floor muscles form a sling, or like I said, a hammock that run from here all the way through the back. So those are the pelvic floor muscles. Now a Kegel is essentially a squeeze or a contraction of those muscles. So what does a Kegel not look like? A Kegel does not look like this. A Kegel does not look like this, really squeezing hard through the butt. A Kegel more looks like this, where I just did it. You weren't able to tell that I was doing it. I was able to talk and breathe while I was doing it. So how do you do a Kegel? So what the first thing I want you to do, literally as blunt as I can put it, think about squeezing at your anus. So think about squeezing the muscles that would stop you, essentially that would stop you from passing gas. If you really, if you were bloated and had a lot of gas, that's the muscles I want you to think about squeezing first. So think about squeezing your anus or your butthole essentially. Then think about squeezing your vagina. So we're gonna go anus, then vagina, and then urethra, where the pee comes out of. So it's kind of from back to front. I want you to think about squeezing just like that, okay? And then I want you to think about a lift at the pelvic floor. So in other words, when you squeeze, you're gonna go back to front and really lift in through the pelvic floor. That is how I want you to do a Kegel. If we're gonna coordinate it with breathing, I really want you to make sure you are not holding your breath, number one. Secondly, try not to inhale, so don't go or like that as you do the Kegel. And thirdly, I really want you to practice exhaling, so breathe out as you squeeze. It may feel really weird, may feel really difficult, but that's what I want you to work on for now. If you have any questions or concerns, please reach out, but that is how you do a Kegel.